Mothers' experiences raising children with hemophilia and developmental disabilities, focusing on disclosure of disorders. Hemophilia is a hereditary disorder in which blood does not clot well. In the 1980s, blood products coagulation factor concentrates manufactured from blood collected in the United States were administered to Japanese patients with hemophilia. As a result, approximately 1,400 of about 5,000 patients became infected with HIV. At that time, HIV/AIDS was widely feared as a fatal disease, and strong stigma surrounded the infection. Consequently, even hemophilia patients who were not infected with HIV were prevented from attending school or were denied medical care at hospitals. Under these circumstances, there was a period when it was difficult for individuals to disclose that they had hemophilia. Therefore, parents may not always disclose their child's hemophilia due to fear of others' prejudice. In addition, when children have other disabilities, parents may face many challenges. This study explored mothers' experiences related to the disclosure of their children's hemophilia and additional disabilities. Mothers of patients with hemophilia were recruited through patient associations and snowball sampling. Semi-structured interviews were conducted. Among the participants, 2 mothers had sons with hemophilia who also had developmental disabilities. We conducted reflexive thematic analysis on the experiences of these 2 participants. We extracted 2 themes and 5 sub-themes. Mika and Kaori are in their 50s. Both have eldest sons who were diagnosed with hemophilia in infancy. Both mothers experience being equated with other diseases, encountering negative support in educational settings. Also, they experienced feeling rejected when trying to act together, which lead to theme 1, non-disclosure of the disorder. Because of these experiences, Mika and Kaori decided not to disclose their son's hemophilia. However, concealing their son's hemophilia led the sons to experience being accused of unfairness and being bullied. These are further categorized in Theme 2, difficulties from misunderstanding. Several years later, their sons were diagnosed with developmental disabilities at ages 17 and 18, respectively. Kaori and Mika had kept their son's hemophilia undisclosed. Mika only disclosed her son's developmental disability. This allowed her son to obtain employment through a disability employment program. Meanwhile, Kaori also informed the vocational school about her son's developmental disability, but he was forced to withdraw. He then concealed his developmental disability while working part-time jobs, but repeatedly faced experiences where he was bullied as a strange guy and fired. That is, he experienced the same situation as with his hemophilia themes 1 and 2. Finally, Kaori encouraged her son to disclose his hemophilia and developmental disability. This led to understanding from his coworkers, allowing him to continue his part-time job. This study demonstrated that disclosing disorders, particularly hemophilia, may not be easy. A proper understanding of the disorder is desired. Thank you so much.